Hi, my name is Zaid Ali. I'm here to do my project interview. I'm here with
Dr. Hisham Abu Omar. I'm a physician specialized in rheumatology and integrative medicine.
and today we'll get into his work and study and ask him a couple questions. Thank you for joining us. The first question is, can you share the story of what inspired you to pursue medicine and specifically rheumatology?
As a young man, I was interested in biology since I was at high school. Then when I joined the School of Medicine, I became interested more and more with the musculoskeletal system and the bone and the muscles and their illnesses. So when I finished my medical study, I started my specialty in rheumatology because it explains a lot about the human illness, which is variable. It could happen in the muscles, in the joints, in the GIT, in the gastrointestinal system, or in the nervous system.
What led you to explore or integrate alternative or complementary approaches alongside conventional medicine?
Approaching the integrative medicine and applying it in my practice came from the sense of failure and disappointment which has been faced by patient and by me as well, because many chronic illnesses are not being treated probably with conventional medicine, which is in the form of suppression of the symptoms and signs of the illness without proper treating of the underlying cause of illness.
How do you define integrative medicine and how does it differ from traditional Western approaches?
Okay, integrative medicine is a combination between alternative and complementary medicine along with the conventional medicine, so it's a combination. It doesn't exclude any part of the medicine, and it combines the benefits from multiple directions for the benefit of patient.
What does holistic patient care mean to your practice?
Holistic care for the patients means to look at the patient as a human being, not as a patient. He's a person. So we have to define which disturbances is happening there at the level of physical body, etheric body, spiritual body. That's why we treat the whole person, not just the terminology of the illness.
Could you describe a memorable patient experience that illustrates the value of combining rheumatology with integrative medicine?
Actually, I have many memorable patients with whom I have experienced the benefit of integrating both the complementary and conventional medicine together. Because in the field of integrative medicine, we are searching for the underlying cause of illness that could be in the level of physical body, in the form of deficiencies of vitamins, minerals, enzymes, or food intolerances, or accumulation of chemical toxins or bacterial toxins in the body, or at a higher level, accumulation of toxic beliefs and thoughts. I remember this patient who came to me complaining of a diagnosed disease, very severe chronic illness, which was multiple sclerosis. And this is a big problem with many young men right now. The MS disease is an autoimmune of the nervous system which attacks the myelin layer of the brain cells and the spinal cord as well. So it may cause weaknesses in the periphery and some other neurological symptoms. And this patient, when we started dealing with her case, we have detected some imbalances at the level of nutrition and vitamin deficiencies and mineral deficiencies as well. And when I started rebalancing these imbalances, she started to get better in a marvelous way, but after a while, her case was declining, and I recognized that something wrong is still there. And when I approached her case in another way, which is the psychological level, I found that she has many issues with her family, the sisters and brothers. And when I started to introduce another way in the integrative medicine, which is reprogramming the subconscious mind, because the subconscious mind is the governing element for the immune system. And when all the beliefs and concepts in our mind, the subconscious mind, is corrected, the whole immune system is going to work in a proper way. That's why this was one of the most memorable patients in my practical life.
Thank you. That was a great answer. Now, I have another question for you. What kind of chronic conditions or patient concerns are best served by an integrative approach?
Integrative approaches are very suitable for almost all the chronic illnesses. This includes autoimmune diseases like rheumatoid arthritis, psoriatic arthritis, systemic lupus, multiple sclerosis, fibromyalgia, chronic fatigue syndrome, Crohn's disease, and ulcerative colitis. Almost all the autoimmune illnesses are benefiting from integrative approaches. Also, some other diseases which are not chronic autoimmune disease will benefit also, just like the tumors, cancer, and hypertension, diabetes. Almost all the diseases will benefit from integrative approach, especially that in integrative approach we deal with the person rather than the name of the disease. So we try to treat the person as a whole, as one tree, not just the branches or leaves and roots as a separate parts, but as a one tree.
In your experience, how do patients respond when introduced to integrative treatments, especially those who are used to conventional prescriptions?
Because most of my patients, when they come to see me, they have already went through all other conventional medicine procedures, including the prescription medication, the chemical medication. So, and when they come, this happens because they have not found enough results or satisfactory results while have such kind of medicine. So they are in the process of searching for a better diagnosis, a better detection of the underlying cause of their suffering. That's why they are very welcoming, and they are ready to understand what I'm searching for or what I'm trying to help them with, including how to correct their lifestyle, their nutrition, their exposure to toxic elements in their daily life, either toxic chemicals or toxic viruses and bacteria and fungus. That's why they are willing to accept such concept of integrative medicine.
Do you believe that the current healthcare system supports or hinders the integration of holistic care, and in what ways?
I think this is a very important question because in general, the current health system doesn't support integration of the alternative and the complementary approaches in the mainstream medicine. However, some universities and medical schools, especially the elite one, are starting to introduce such education for their students because they know how much it will benefit the patient as well as the medical students as well, the doctors, the future doctors who are going to have full control over the process of healing especially when the medical doctors know the underlying cause of illness. They can choose the proper treatment, and the proper treatment here doesn't mean proper medication, because the treatment or healing is a much bigger concept than just medication. Healing means how to help the body to heal itself, how to enhance the power of self-healing.
What changes would you like to see in medical education or policy that would help more doctors adopt a more integrated approach?
I think during the few coming years, there will be a good change in the medical education, especially that the demand among patients for the integrative health system is increasing. That's why more medical students and more doctors are going to learn how to integrate this in their practice. And instead of integrating this after qualification in the medical school, I think that most of the medical schools, especially in Europe, in Germany, where I have been trained, they integrate this at the level of undergraduate study. And also it's available for any kind of conventionally trained physician to have such integrative training if he missed this education during the undergraduate. He can add this in the postgraduate courses, workshops, fellowships, and so on.
How has your identity as a physician evolved over time, especially as someone working across different schools of medicine?
I think starting as a physician 25 years earlier is completely different from what I'm here now. The change and the evolution that I experienced is not just at the level of professional way or the professional level, but also at the intellectual and spiritual level. Because when you know that a human being is not just a device, he's a soul, he's a mind, he's a physical body. In this way you think that as a physician, as integrative medicine physician, you will think that you are responsible for the most precious thing in the universe. It's not a freezer, it's not a car, it's not a motorcycle, it's a human being. So you are dealing with an identity that have a spirit, that have a soul, and that have a physical existence.
What has working in both rheumatology and integrative medicine taught you about healing on a personal and philosophical level?
The autoimmune disease usually occur as a result of not just deficiencies or excess in some source of toxins in our body, but because of the feelings and concepts. And these feelings and concepts among some patients who are usually have a low self-esteem or a problem in accepting themselves, they usually hate themselves unconsciously at the unconscious level. So in the rheumatology medicine and in the autoimmune illnesses, I usually address this aspect, how to reprogram the patient's subconscious mind to help him or her to accept themselves and love themselves.
If you could give advice to medical students or young doctors curious about integrative medicine, what would you tell them?
I would like to tell the young doctors and medical students that integrative medicine is something that is very related to quantum physics, especially the property of quantum entanglement. And physics is very important in our universe and in our life, because all physical interaction precede the chemical reactions. That's why any change in our biology is usually due to chemical reaction, either a proper chemical reaction or a faulty chemical reaction. And these chemical reactions are preceded by physical interactions. And physical interactions, it's a change in the belief or concept or the signals around us, either from physical signals like microwave, Wi-Fi, radiation, ionizing radiation, and other physical things, or from the feelings that we exchange with each other. This is an important part, not just the food and vitamins and supplementary products, but also the belief. That's I stress on this fact that all doctors and medical students have to study this aspect of physics to understand integrative medicine. An important part in the integrative medicine is how you use it with patient. You, as a doctor, as a physician, you choose which approach you can use with each patient. So it's not a fixed frame of approach or modalities. It's different from one patient to another. So combining the nutrition with orthomolecular medicine, with naturopathic medicine, with homeopathic medicine, with physical modalities, just like using low-level laser or cold laser, and electrotherapies and ultrasounds. All these physical modalities have its own effect on the ill organs in our body. And most important thing is the clinical assessment of the patient rather than the laboratory or radiology examination or diagnosis, because we have in our body the biggest lab and the biggest radiology, bigger than the radiology offices. It's the autonomic nervous system, which can reflect our body state of illness or health from just testing the muscle of the patient. And this is very important part, which is not being told to medical students, that we have some kind of a human device that can help us, especially in a remote area or when the investigations need more time to be carried out, or when the financial aspect is not suitable to carry on all these medical investigations. So it comes to use the autonomic nervous system in our body to diagnose many things like toxins, food intolerances, vitamin deficiencies, and other. And this is one of the most important things that I recently started to become interested in, and I encourage my colleagues to learn such techniques.